Hi, my name is Kieran Connolly. I work at ENT and Allergy of Delaware, and this talk is designed to give patients some information about new approaches to managing obstructive sleep apnea. So, as I mentioned, I work for ENT and Allergy of Delaware. I'm in private practice. Um, a lot of the focus is going to be about a device made by Inspire, and I don't have any financial ties to Inspire. So the focus of the talk will be hypoglossal nerve stimulation surgery. It's also referred to as upper airway stimulation therapy or Inspire. So first I'm going to talk to you about some basics of obstructive sleep apnea. So obstructive sleep apnea um, involves the collapse of the upper airway and obstruction of the upper airway during sleep. So the upper airway is a um, collapsible tube, and when we breathe in, it's like a vacuum and it pulls that collapsible tube closed and causes us to obstruct. And so if you think about sleep as a continuum, you start out awake and then you start to fall asleep, and as you fall asleep, you may obstruct and then you wake up. And you may not know you're waking up. It may not be to the point where you're completely awake, but that happens all night long. And as a result of that, you never get down to restful sleep. So how do we measure it? Well, we can measure it with what's called a sleep study. Most of you have probably had sleep studies. And the primary focus that we're interested in the sleep study is called the apnea-hypopnea index, which is the number of times you stop or pause breathing per hour of sleep. We also look at other variables like the level, your oxygen level, when these obstructions occur. And obstructive sleep apnea is extremely prevalent. 20 million Americans have moderate to severe obstructive sleep apnea, and it has significant consequences. There's the obvious, we're snoring loudly and bothering our bed partner, but we wake up, we don't feel refreshed, and it can lead to fatigue, diminished productivity. It also has significant implications for our heart and brain health, and it can put us at risk of accidents. There's also a high prevalence of chronic disease in obstructive sleep apnea, including heart failure, high blood pressure, but even things like depression and diabetes are associated with obstructive sleep apnea. And treating the obstructive sleep apnea can help treat these conditions. So, what are treatment options for obstructive sleep apnea? Well, there's weight loss. And so we always encourage patients to make efforts at weight loss, but not everybody needs to lose weight that has obstructive sleep apnea. There's CPAP, which is called continuous positive airway pressure therapy, and it's the most cost-effective and clinically effective treatment for obstructive sleep apnea, and it's currently the gold standard to treat obstructive sleep apnea. But not everybody can tolerate CPAP. And ultimately, somewhere between 48 to 83% of patients fail to tolerate CPAP. But sometimes this is because they haven't tried the right mask. So there's masks out there that maybe you haven't tried. Sometimes it's because of the degree of pressure that the CPAP is pushing at you. And so there's a thing called BiPAP where the pressure when we breathe out isn't as great as the pressure as when we breathe in. And so sometimes this will make it so that people can tolerate sleep apnea, CPAP. There's also oral appliances, and they pull the lower jaw forward and can help open the airway. But in most studies, they are only effective for mild obstructive sleep apnea. And so then there's surgery, and most surgeries in the past involved removing parts of the jaw, tongue, or throat to enlarge the airway, but they can be very difficult to tolerate. Now, not every patient is the same, and so we have to look at every individual. If you come in and you have huge tonsils, maybe that's the problem. Maybe that's why you have obstructive sleep apnea, and maybe that needs to be addressed. Maybe you can't tolerate CPAP because you have a deviated septum. Here we see a severely deviated nasal septum. Maybe that's the reason. And maybe if we fix that deviated septum, you would be able to tolerate the CPAP machine. But ultimately, there's going to be patients who are unable to tolerate these therapies. And so there's now a new therapy for obstructive sleep apnea, and that's called hypoglossal nerve stimulation surgery or Inspire. It involves making an incision in the neck, and we find the nerve that moves the tongue, and that's called the hypoglossal nerve. And then we figure out which branches of that nerve stick the tongue out and which branches pull it in. And so it provides mild stimulation to the branches of the tongue which push it forward and open the airway during sleep. And so here we see the effect of that stimulation. So in this picture, the tongue is sitting back in the throat and the airway is collapsed. And if we look with a scope from above, here you see that. This is the base of the tongue, this is the top of the voice box, and this is the back wall of the throat, and you don't see an opening here. And this is the palate. This is the part of the throat behind the nose, and the palate is also closed. And then we stimulate that airway and it pulls the tongue forward, it opens the airway, it also pulls the palate forward. And so if we put that same scope in when the patient has been stimulated or that hypoglossal nerve has been stimulated and the tongue has moved forward, the airway has opened, and the airway at the level of the soft palate has also opened. There's a second incision in the chest where we put a device in that's similar to a pacemaker, and it provides the stimulus. But we also put a lead or a sensor in between the ribs, and that lead or sensor senses our breathing. And the whole idea is that because that collapsible tube is collapsing when we're breathing in, that the stimulus occurs when we breathe in. So every time we breathe in, our tongue moves forward and opens the airway so that we do not have obstruction, and hopefully that improves or cures our sleep apnea. So this is well-established technology. It's a safe outpatient procedure, so the vast majority of patients go home after the surgery. As I mentioned, it involves 2 incisions. It's adjustable, right? So not everybody needs the same amount of stimulation to get a good result or good tongue movement. And it's titratable, and that what that means is that we can put you to sleep, and we can adjust the device while you're asleep in a lab, and we can determine at what level your sleep apnea improves or is cured. Here you see the incisions afterwards. This is the incision on the neck. It's very difficult to pick out. And then there's the incision in the chest, and there is a little bit of a bump in the chest due to the device itself, especially if you're a thinner individual. So what do the patients feel? Well, they feel a little bit of stimulation to their tongue. They feel it being pulled forward. I like to describe it as if you've ever had the doctor hit you on right below the knee and your leg moves and you didn't really tell it to move, but it does it on its own. That's kind of the way it feels, right? So the tongue is moving, but you're not telling it to move. It's adjustable. So again, not every patient requires the same amount of stimulus. And so, if it's uncomfortable at one level, we may be able to adjust it so that it's not uncomfortable. And the vast majority of patients um, tolerate the procedure well and are well acclimated to the device after about a month. So what's the process? Well, the first thing is the surgery. So you have the implant placed. 1 month after surgery, it's activated, it's turned on. And then you slowly increase the level of stimulation as tolerated. And then eventually you go to the lab where you have a titration study where we actually determine at what level it cures or significantly or hopefully significantly improves your obstructive sleep apnea. And then once or twice a year you meet with a doctor just to make sure everything is going well. So how do I know if Inspire is right for me? Well, you have to have moderate to severe obstructive sleep apnea. You have to have difficulty with CPAP. You have to have the inability to get consistent benefit from sleep apnea, from CPAP. You can't be significantly overweight, and you have to pass an airway exam. So we put a scope down with you asleep, kind of like you would be asleep for an endoscopy or colonoscopy. We want you actually snoring, and then we look down there with a scope and we watch how your airway collapses. You have to be at least 22 years old, And if you've had previous apnea surgery, such as a uvulopalaryngoplasty or UPPP, that's not a contraindication to moving forward with Inspire. If you haven't had a recent sleep study, you may have to have a new one. Most of the time, you have to have had a sleep study within 2 years of being evaluated for Inspire. Well, what are the results? Well, overall, there really are excellent results with Inspire. So we in studies they've seen an 88% reduction in the apnea-hypopnea index with Inspire versus only 29% for the more traditional surgery UPPP. The overall success rate is 87%, and what that means is that 87% their AHI fell by more than 50%. And in almost 60% of the patients, they were cured, and that means that their AHI fell below 5. And that AHI reduction has been maintained over the years. Most people notice a dramatic decrease in their snoring. So they have no or soft snoring, goes from 17% preoperatively to no or soft snoring 90% of the people postoperatively. And the number of people leaving the room due to snoring, or the partner leaving the room from snoring, decreased from 30 to 5%. And overall, most patients, 90%, felt that Inspire was better than CPAP. So just to summarize, there is clinical evidence that Inspire provides significant benefit. It's been in multiple peer-reviewed publications. It reduces the severity of obstructive sleep apnea and improves quality of life. This improvement has been maintained in the long run, and most people adhere to treatment in the long run. And here again, you see that there's been over 100 peer-reviewed publications. There have now been over 20,000 patients implanted with Inspire. As far as insurance goes, the vast majority of insurance companies uh, cover Inspire. It's also covered by Medicare, and in many cases, it's covered by the VA hospital. If you want to learn more about Inspire, you can go to inspiresleep.com and you can review the lists of benefits and important safety information. But they also have a patient ambassador program where you can actually speak with somebody who's had the surgery and uses the device, and you can talk to them about their experience. If you need more information, my name is again Dr. Kieran Connolly. My office number is 302-998-0300. There's also other information available. There's a number that you can call if you have insurance questions. And you can look at the talk and you can see this number. And for the VA, you can call this number. There's also an Inspire Sleep app. And there again, you can learn how Inspire works. You can watch short videos that answer a lot of the most common questions. And again, you can connect with people who've had the procedure. And you can watch instructional videos about how to use the device. And so hypoglossal nerve stimulation surgery, or Inspire, is a new tool in the toolbox to treat obstructive sleep apnea. And I have to say, it's been my experience. I started out as kind of a skeptic about the surgery, but the more people that I've implanted, the more I've learned how well it works and how many patients have achieved significant benefit from this new surgery. Thank you.